This is the FAIR test as presented by Alyssa Hartley, Max Powers, and Vince Wynn. The biomechanics of the FAIR test. By flexing, adducting, and internally rotating the femur, the anterior aspect of the femoral neck is in contact with the anterior rim of the acetabulum. If the femoral neck and or the acetabulum have an extra bony growth, this position will cause pain, and it's also known as the femoral acetabular impingement. It can be a pincer deformity, which is when the acetabulum has an overhang, or it can be a cam deformity, which is when the sphere of the femoral head that is connected to the femoral neck is not spherical. It can also be a combination of the two. In addition, by flexing and adducting the hip, the head of the femur is moved to be against the acetabular rim. Then, internal rotation creates shearing on the labrum that covers the acetabular rim. If a piece of the labrum is frayed or torn, this position will cause pain due to a labral tear. Lastly, since the piriformis originates at the ventral surface of the sacrum and runs through the greater sciatic to insert on the superior part of the greater trochanter, hip flexion, adduction, and internal rotation puts the muscle on stretch. The sciatic nerve runs under, through, or splits the piriformis. Thus, stretching the muscle puts pressure on the nerve and can cause pain, numbness, or tingling. The indications for the FAIR test include groin pain, anterior hip pain, painful hip clicking, feeling of instability in the hip, buttock pain, or pain with crossing legs and sitting. There are no contraindications. However, if someone has a diagnosed hip osteoarthritis, this test will be painful and will not elicit any additional information.
Hi Vince, my name is Max. I'm going to be your physical therapist today. Can you show me what's going on in your hip?
I'm just kind of feeling pain around this area, right here.
Okay, based off the location of your pain, I'm going to be performing the FAIR test today. The FAIR test can help me determine if what's going on in your hip is any of these three things.
This is a picture of femoral acetabular impingement, or FAI. This picture is depicting a cam and a pincer lesion. This picture is showing a labral tear. This picture shows where the piriformis is located in the body and how it is positioned relative to the sciatic nerve.
The first thing could be FAI syndrome, which is femoral acetabular impingement. So what your hip is like a ball and socket joint, and if there's an extra growth on either the socket or on the ball, the position I'm going to be putting your leg into could cause those to butt up against each other and cause that pain. The next is a labral tear. So the socket has a little growth, which is like a tissue that causes cushion for that ball and socket joint. If that cushion or tissue has a little tear in it, then the position I'm going to be putting your leg is going to butt up against that and could cause the pain symptoms as well. The last thing it can pick up is piriformis syndrome. So on the back side of your leg, there's a muscle called piriformis, and the sciatic nerve goes right underneath that muscle. If that muscle is either tight or inflamed, it can cause compression onto the nerve, which the position I'm going to put your leg in is going to could cause that to elicit the same symptoms that you're feeling today. Okay, so what this test entails is I'm going to just have you lay flat on your back. I'm going to move your leg passively into those positions that I was talking about earlier. And so what you can expect is either just to feel a slight stretch or nothing at all. Or when I get your leg into the position I want it, you could feel the same symptoms and pain that you were complaining about earlier today.
Step by step for the FAIR test. First, have the patient lie supine. Make sure you test the uninvolved side first. Cradle the posterior aspect of the lower leg and place the other hand just superior to the knee in order to guide and support the leg. Passively bring the hip into 90 degrees hip flexion, adduction until in range, and internal rotation until in range. This is just before the pelvis comes off of the surface. Ask the patient if there is any pain or if symptoms are reproduced. Then repeat on the involved side.
Okay, Vince, can I have you go ahead and lay down your back? And so I'm going to first perform the FAIR test on your left leg. I know you're having symptoms on the right side, just to show you what it is. And just see what we got here.
And I would agree, you don't have to go there and check to make sure the cold pack or the hot pack machine is appropriate. Okay? I would totally agree.
Okay.
Okay?
That's the test. Now I'm going to do it on the other side. So go ahead, can you scoot over to this side?
Yeah, there, it's right there.
Okay, and that's in front of your hip?
Yep, right here.
Alright, and is that the same symptoms that you were complaining about?
Yep.
Okay.
Test outcomes. A positive test for FAI and or labral tear would be the reproduction of the patient's symptoms in the anterior hip. For compression of sciatic nerve by the piriformis, a positive test would be reproduction of pain at the point of intersection of the sciatic nerve and the piriformis in the posterior hip. This is according to Fishman et al. In 2002 and in 2003. A negative test would be no symptom reproduction.
Alright, Vince, I got a positive test on your right side for the FAIR test. So the location of your pain and the positive test I got leads me to believe that it could be either an FAI problem or a labral tear.
The FAIR test psychometrics. A little bit on sensitivity and specificity. So sensitivity means that the higher the number, the more likely that a negative result indicates the patient does not have the proposed underlying dysfunction. Specificity means that the higher the number, the more likely that a positive result means the patient does have the proposed underlying function, in this case, that the FAIR test is testing for. According to Philippon et al. In 2009, the psychometrics for FAI are a sensitivity of 0.99, and they did not determine a specificity. According to Martin et al. In 2008 and Burnett et al. In 2006, for an acetabular labral tear, the sensitivity can range from 0.59 to 0.95, and the specificity can range from 0.1 to 1. According to Fishman et al. In 2002, for piriformis syndrome, the sensitivity is 0.88 and the specificity is 0.83.